It has been well established that Patient and Family Advisory Councils, or PFACs, are an excellent way to capture the patient's voice and perspective. These councils help healthcare institutions and providers to hear the voice of the patient, identify the needs of their patient population, and bring patient and clinicians' views closer together. In this 4-part series, we'll hear from leaders in this area and explore the important role of PFACs as hospitals navigate the COVID-19 pandemic. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle with AHA Communications. In this episode, Elisa Arespacochaga, AHA Vice President of Clinical Affairs and Workforce, sits down with Robyn Begley, AHA Senior Vice President and Chief Nursing Officer, and Pamela Rudisill, Senior Vice President and Chief Nursing Officer at Community Health Systems, to discuss the value of nursing leadership in PFACs.
Thanks, Tom. To get us started, Pam, I'm going to start with you, and I'd like to hear a little bit about your experience with patient and family advisory committees through your career.
Okay, well, thank you so much. My experience with the Patient Family Advisory Councils has really followed the evolution of the concept. Years ago, as a hospital CNO, we arranged for patient family representatives to meet with clinical leaders, administrative leaders, patient advocates, and et cetera, just to provide feedback on their experiences, the good as well as those that we needed to hear about for improvement. So fast forward that to the present day, PFACs are well developed and an integral component in the comprehensive approach to improving the patient experience, but I would also add the safety and quality of care for our patients and our families. So specifically in my role as System Chief Nursing Officer for a large healthcare system, I'm also responsible for the patient experience. So now I have, I think, a much broader experience with and appreciation for PFACs. Several years ago, we researched, developed, and we implemented a toolkit for more than 80 of our hospitals, and it continues to evolve. During COVID, however, like everyone else, PFACs moved to a virtual process in order not to lose the important connection with our patients and families. And in addition, even through the COVID pandemic, we've been able to follow through with feedback, observation, and really to determine the impact of the outcomes from having a patient family advisory council.
Robyn, from your work as CEO at AONL, what have you seen from the national perspective about how PFACs have been impacting nursing and vice versa?
Thank you, Elisa. I couldn't agree with Pam's comments more. So in my history, I had the opportunity to participate as a nurse director on a PFAC in the early days, and then as CNO of a health system in New Jersey prior to this role, I served as the chair of the PFAC because I also had responsibility for patient experience. You know, that connection between the nurses and nurse leaders and quality and safety. And I think in translating that with our patients and their family members, I mean, it just seemed to me at the time the perfect marriage to get, nurses and other members of the care team certainly together with our patients and advisory committee members. And the dialogue was just natural. It was really interesting to see nurses from the care delivery perspective explain to the patients and the families sort of, some of the inner workings, if you will, of healthcare, and patients and families really responded to that. So it just was a perfect blend of perspectives. And I think both came away definitely with a richer picture of what healthcare, what it takes to provide superior care and with quality and safety as the key components. I think from a national perspective, though, I would also add that we believe AONL, that all nurses have the potential to be leaders, and we really want to hear the voice of nurses on different committees and councils, and PFAC certainly is really a prime opportunity for our nurses and nursing leaders to become involved.
Absolutely. Pam, you mentioned that COVID really affected how your PFAC went forward, but can you talk a little bit about how it changed some of that engagement across your health system and how you used the PFAC during COVID to connect?
Yeah, thanks for that question. It really brought forth the importance. If we ever doubted the importance of a PFAC, the COVID pandemic has really put forth no question that it's an important entity. I think first because the pandemic was uncharted territory for all of us. The urgent need to focus on the impact to the patient and family could not be underestimated, and even to this day. The work of caring for these extremely high acuity patients by the dedicated staff that all of us had, no matter where we were across the country, certainly was challenged by the use of protective measures, the PPE that made communication and the human connections needed very difficult is an understatement, I think, from that standpoint. So keeping this aspect, the critical aspect of that human connection close to us day by day that supports our mission, it really helped as we looked at the ever-changing emotional, social, mental, and certainly the physical needs of the patient to focus more effectively and better. For instance, in our own system, and I know I've heard stories through all the support that AONL has given and AHA through this pandemic, but of our frontline physicians, our frontline nurses, and other caregivers, they became the creative energizers to find ways to effectively deal with the altered means of communication that we had to provide for our patients and our families. During this time too, I think we, as well as other systems, we had to seek out other providers in the healthcare system, not just our direct caregivers, but IT became our close friends, if you will, on day-to-day, minute-to-minute operations. Biomed, plant ops, environmental services. So I think that it brought us all closer together for what all of our missions are at hospitals and healthcare systems, and somewhere along the way to provide the best care possible for the people in the communities that we serve. So it took an entire village. It was all the other clinical disciplines as well. I don't want to exclude anyone, but respiratory therapy, the lab, the radiology, the dietary, all of us working together during this. And finally, it showed us that we can do. It showed us that we can be innovative and we can come up with methodologies and care for patients that we never thought possible. But at the same time, with that PFAC component, listening to what our patients and families were telling us every single day certainly helped us to better care and continue to care for these patients.
In addition to what Pam just stated so eloquently, I have to say that across the country, we heard, of course, that COVID has accelerated innovation in many aspects of care delivery, and also specifically to PFACs. Pam mentioned remote meetings. We know that PFACs were utilized to review new processes and policies that needed to be really almost day by day, particularly in the beginning, redeveloped and redesigned. And that was very helpful to have access to those PFAC groups virtually. The other thing I think I just wanted to mention too, that in addition to the village that Pam mentioned, we know that medical students and nursing students really had a very significant role in communication with patients and families. And, again, this was another innovation of using, folks that perhaps were put into a role that wasn't their intended role initially, but served very well and really helped enhance the care for our patients and and family communication.
Couldn't agree more. Thanks so much, Robyn. Now, I'm going to pick up on a theme you had there, the value of really spreading our teams across multiple different activities and maybe not necessarily staying within their same roles. And Pam, I know you have done quite a lot of work involving nurses in different boards and committees. Love for you to talk a little bit about some of the values you've seen involving nurses in committees like PFACs early on in their careers to really build some of those skills.
I'm so excited and privileged to serve as AONL's representative to the Nurses on Board Coalition, which is a coalition of 24 national nursing organizations and many more partners, and really appreciate this opportunity. Through this work, we've talked with Robyn and actually some other colleagues, AARP and within OBC and AHA, I know last year and started some of this, but really through COVID and through some of this, it really came to light. How can we get more nurses active on committees and ultimately serving as board representatives to whatever, to your community boards, to regional boards, to national boards, from healthcare and outside of healthcare. And one of the things that have come up, and Robyn mentioned nursing students, and I'm so glad that she did, because I think we're in this era for a number of reasons, but the nursing workforce, I mean, we could go on in this and really talk about a lot of other things, but how can we get younger nurses engaged in serving on a board at some point in their career? Well, most people don't jump from a new graduate with 1 year or 2 years of experience onto maybe a national board like AONL or whatever. So what better way to start than something like a patient family advisory council? A nurse, no matter, as Robyn said, every nurse is a leader. So why not start through that? That's where that bedside frontline expert clinical nurse knows best. A patient family advisory council. They're with the patients the majority of time during their work shift. And we saw through COVID, these can be the most creative, innovative individuals for care delivery that you would ever want to meet and for patient experience. So this would be a great opportunity to start and get a nurse, but I don't want to limit it to that. I know we've talked about what the other end of the spectrum, that nurse that's maybe ready to retire and enjoy other things in life. But my goodness, the expertise of serving on a committee with that. But irregardless of that, I think, we found through a lot of the research and all, you need support people. And I know AONL has done a great job with all of the publications and educational offerings through that, just having the virtual meeting. NOBC has done some work as well. Kim Harper and some of the other representatives looking at what are support roles for nurses that want to serve on committees and serve on boards. And they're really into 4 categories: a mentor, a preceptor, a sponsor, and a coach. Now, all of those, I think, sort of interrelate, but at the same time, they all offer different categories. So perhaps looking at that with serving on a PFAC to get what better way. Robyn talked about being a nurse director serving on a PFAC, a nurse director that's already got years of experience, or a CNO, or somebody else on the PFAC to sort of mentor that person through. So those are just a couple of thoughts, Elisa, on that subject.
Yeah, and Robyn, I know you have certainly seen value in involving any clinician on your PFAC, both from a leader perspective and in your work locally. Any other thoughts to add to that?
Yeah, I think, Elisa, that the benefits are at least twofold. So it's important for the nurse, or you fill in the blank, the physician, the respiratory therapist, the other clinician, to really see the impact of the voice of the patient and family on the organization and see how important it is. I know that one-on-one clinicians deal with patients and families, they have interactions all the time, all day long in their professional life. But to see the group, see how the agenda is developed and what they're really being asked to weigh in on, I think is very powerful. And then from the PFAC member perspective, I think it's important that they also see that frontline and, nurses and other healthcare professionals in different roles, what they add and how they contribute, to policies and procedures that are developed and just really the impact that they have by participating. I think it's really a win-win from all aspects.
I'm going to ask you each to share a little bit of advice you would pass on to your nursing colleagues, or even, if you could go back in time to yourselves, newer nurses. What would you say about getting involved with a PFAC, or the value that you would say to one of your colleagues? Pam, let's start with you.
Well, I would say whether you're the beginning, middle, or near the end of a nursing career, the leadership abilities, the knowledge, expertise, perhaps most of all, the passion and compassion for patient care. This is the perfect combination for nurses serving on a PFAC, other committees, moving on into other venues with board placement and that sort of thing. But just looking from the PFAC standpoint, nurses have an understanding of the communities they're in, the challenges, the ability to communicate effectively, to listen effectively, the research and evidence-based practice that nurses bring, financial efficiency, and overall the quality for safe patient care and the compassionate care. Nurses are just perfect to do this.
And in addition to what Pam just said, I would say that it's very rewarding and enlightening, and I would recommend that all nurses consider serving their local community and their local healthcare organization by participating on a PFAC.
Thank you so much. From two perfect nurses I know, really thrilled to get to hear your thoughts on how you've been involved with PFACs and the value that they've brought both to you, to your organization, and to the work that you've done. Thank you so much for joining us.